very common as a prolotherapist for me to hear about patients getting advice from their doctors that they're going to go in and clean out the joint to remove bone spurs or to actually replace the joint. And they ask me, is there an alternative to that? And I say absolutely. And one of the examples that I use in the office is the notion of two cabinet doors hitting. And we all know that when a cabinet door is loose, and it starts out with one of the screws being loose. So here you could see the one screw is loose. Now if you tighten that screw, you basically cure the problem. If you don't tighten the screw, the next screw is going to get loose, the next screw is going to get loose, and then all of a sudden the door is making a lot of noise because this hinge is loose, which gets that hinge loose, and then all of a sudden the doors start hitting. And when the doors start hitting, basically what happens, this gets worn out. So you can think of this as this is one bone and this is the adjacent bone. So what happens is when adjacent bones start hitting, the body is going to overgrow a bone spur, and that bone spur is going to stabilize this area. So imagine if you were my neighbor and you saw me with sandpaper. So you saw me with sandpaper and I'm sanding this door. You'd say, what are you doing? And I'm like, no, the two doors are hitting. Like, see, it's making a noise and I'm trying to sand this. You'd say, that's ridiculous. The hinge is loose. You got to get a screwdriver. You got to get a screwdriver. The treatment for this is tightening the hinge. It's not sanding the door. What about if you saw me, I'm taking this door out and I'm putting this door in? You'd say that's ridiculous. All you have to do is tighten the hinge. So think about somebody who has hip impingement syndrome, or they got bone spurs in their knee and the doctor's going to go shave this and shave that. Well, first of all, if you do that, guess what's going to happen? So imagine I put some tape here. I put some tape here so this stays in alignment. Once you remove the tape, it's still going to be a loose hinge. So a better treatment option is to tighten the hinge, get a screwdriver, or in the human body, you get prolotherapy. In the human body, the hinge is the joint, and the screws represent the ligaments. The ligaments are what hold the joint together. And when the ligaments are tight, as represented by this having all the hinges work properly, when the hinge is tight or the joint is tight, the adjacent bones move properly, they function properly, and there's basically no pain. There's no need for the body to swell the joint or muscle spasms or bone spurs to form. So the best option when somebody has chronic pain, and chronic pain is from joint instability, the hinge is loose, you have to tighten the hinge, and the treatment to tighten a loose joint, to get the ligaments repaired, to get the ligaments strong, is prolotherapy. It's a much better option for bone spurs, or if you've been told you have to have a joint replaced, I'd really encourage you to go see a prolotherapist. We're in Oak Park and Southwest Florida, so obviously I hope that you'd give us a chance to evaluate you, because again, that's a better treatment option, prolotherapy, than replacing the door when really the hinge is loose.